All right, hands up if you think that some version of functional and integrative medicine should be the standard of care in America. Keep your hands up if you're frustrated by the fact that the most poor, vulnerable people in society and tech-illiterate people don't have access to that medicine. I've seen the future, and I've come here today to tell you how it's going to roll out. First of all, we have to get to the root cause of why it hasn't happened. First thing, it's not affordable. Right? It's mainly available on cash, maybe commercial insurance, definitely not Medicare, and definitely not Medicaid. Second, it's not profitable. Doctors doing functional medicine make less than their colleagues, and health systems that have tried and implemented this is not profitable for them to do it. Third, it's not accessible. Despite our best efforts, there's not enough functional medicine doctors to take care of everyone, and even some of the best functional medicine doctors choose to stop seeing patients. Fourth, any medical system built on behavior change is going to struggle because behavior change is hard. So I want to tell you a story about my friend, Dr. Jeffrey Geller. In 1997, he was a medical student, came out into his first year of residency and started to realize that there was more to health than drugs. And he started to realize some people in his community stayed well after a shock, and some people, it was the end for them. And what he saw that was the biggest thing was loneliness. And he thought to himself, what if I started to treat loneliness? So he started a group visit. What started off as a diabetes group visit became a salsa dancing club. And it ran for 20 years. It still runs to this day. Those people didn't need diabetes care because you know what? They're just healthy. At one point, he got to 40 group visits happening every week, working with the poorest and most vulnerable people in Massachusetts, and he teaches his model at the Integrative Medicine for the Underserved. Now, you've all heard about the Cleveland Clinic Center for Functional Medicine, right? So how do they scale up operations there? They dangle the carrot of Mark Hyman and say, if you want to see Mark Hyman, you have to go through a 10-week, 2 hours a week group visit run by PAs, RDs, and health coaches. So where once functional medicine was unaffordable, now it is available on all insurance. Where once functional medicine was not profitable, you can bill 16 to 20 insurances at the same time, and it's the most profitable delivery system at the Cleveland Clinic Center for Functional Medicine, more than one-on-one. Where once there was not enough practitioners to do this, any practitioner can be involved leading these group visits. Some of the best groups are being led by peers. And fourth, behavior change is easy in a group. It's the only way that we can sustain healthy behaviors in a group format because there is a community there to be accountable, supportive, vulnerable in front of, and it lasts. In January, my second book is coming out. It's called A Cure for Loneliness. And it's an operations manual to bring functional medicine group visits to every health system in America. I'm self-publishing this book so that we can give it away free to anyone who wants to read it. I want to put it in the hands of doctors. I want to put it in the hands of health professionals. I want to put it in the hands of administrators, of hospitals, of CEOs of companies who want to try and find a sustainable way to keep people well and reverse chronic illness. Thich Nhat Hanh said, community is the guru of the future. Groups of people supporting each other to stay healthy and reverse chronic illness, that is the future of health.